You're getting your kid changed after a day at the park. Your kid is still muddy, still wound up, and then you see it. Something small and dark, flat against the scalp, and your stomach drops. It's a tick. Dr. Mona here, pediatrician and mom, and we're chatting Lyme disease, the signs, the various stages, and management. Make sure you hit that subscribe button if you're not already so that you don't miss any future videos. Let's get into it. So I trained in Albany, New York, which is real tick country, and I saw Lyme disease up close and personal during my training. So this is not something I learned from a textbook alone. I know what it looks like, I know what gets missed, and I know what happens when families go down the wrong road looking for answers. First thing I want you to do is take that breath when you see that tick. Finding a tick on your child is unnerving, but most of the time it's not an emergency. Most tick bites do not cause Lyme disease. The ones that do, there are signs, and today I'm going to make sure you know all of them. My whole goal here is to give you clear evidence-based information so you know exactly what to watch for, when to call your doctor, and when you can actually breathe easy. I'm not here to scare you, and I'm not here to send you down a rabbit hole. The internet has plenty of those. What I want for you to feel is informed and not overwhelmed. If you're already feeling like, okay, this is my vibe, make sure you hit that subscribe button. I put out videos like this regularly, and I would love to have you here for all of them. Now remember, Lyme disease is treatable. Missing it is the problem, so let's make sure you don't. Ticks can carry more than just Lyme disease. There's Rocky Mountain spotted fever, which I've seen, anaplasmosis, which I've seen, babesiosis, which I've seen, and others. Those are real, and I'll cover them in future videos if you want them, so comment below. But today we're focusing on Lyme because it is the most common tick-borne illness in the United States by a wide margin, with tens of thousands of cases reported every year. If you found a tick on your child and you're spiraling on AI or Google, Lyme is the most likely thing you need to know about, so let's start there. If the tick is still on your child, this is where we start. Grab fine-tipped tweezers or the bug bite thing tick remover. Not the white flat kind you use for splinters. Fine-tipped tweezers. You want to get as close to the skin as possible, grab the tick right at the head where it meets the skin and pull upward with slow, steady pressure, not twisting or jerking, just one firm, even pull straight up. And here's the list of things that sound helpful but are not. No Vaseline, no nail polish, no matches, no burning it off, and please do not squeeze the body of the tick. When you compress the tick's body, you can actually push fluids back into the bite site, which is the opposite of what we want. Close to the skin, steady pressure, straight up. That's the move. Once it's out, clean the area with soap and water and wash your hands. Take a photo of the tick before you toss it. That is genuinely useful for your doctor to help identify if it is possibly going to be carrying Lyme. Now, what about sending the tick to a lab for testing? Some parents find mail-in kits online and wonder if they should use one. And here's the honest answer. At this point, most doctors do not recommend it. Even if the tick tests positive for Lyme bacteria, that does not mean it passed anything to your child. And even if it tests negative, that does not fully clear your child either. The result does not actually change what your doctor is going to do. What matters most is how long the tick was attached and where you live. That is what drives the decision, not the lab result on the tick itself. That said, every clinician is a little different, so if you are unsure, just call your doctor's office and ask what they recommend for your specific situation. One more thing, because I know it happens, if a piece of the tick stays behind in the skin, don't panic and don't dig. Leftover mouth parts cannot transmit Lyme. The bacteria lives in the tick's gut and saliva, so a detached head is basically a splinter now. If it comes out easily with tweezers, great. If not, leave it alone and let the skin push it out on its own. Please do not go after your child's scalp with a needle at 10 p.m. The digging causes more trouble than the fragment ever will. Now, the tick that carries Lyme disease is the deer tick, also called the black-legged tick. And it is tiny. And here's the part that surprises parents. The young tick, called a nymph, is the size of a poppy seed. Yes, a poppy seed, which is so tiny. And nymphs are the ones most likely to bite kids because they're out in force in late spring and summer, exactly when your kids are. The adult deer tick is bigger, about sesame seed size, but still small. The tick parents most commonly find, and actually have brought in to show me, is the dog tick. It's bigger, easier to spot, kind of reddish-brownish, sometimes with a white or cream-colored pattern on its back. It looks scary, but it's actually much less likely to carry Lyme. If you can see a tick clearly from across the room, it's probably not the type of tick that carries Lyme disease. That doesn't mean ignore it, but it does change the level of concern. So where does Lyme actually show up? The highest risk areas in the US are the Northeast, the Mid-Atlantic, and the upper Midwest, especially Minnesota and Wisconsin. There's also growing activity on parts of the West Coast, and the map is expanding thanks to climate change. Deer populations have grown significantly over the last few decades, which means more deer ticks in more places. Milder winters mean ticks survive longer and stay active later into the year. This is not a reason to panic, it's a reason to do your tick checks no matter where you live, not just if you're in the classic hot zones. And just to plug, it's also a reason we should probably care about climate change. Once the tick is out, the next question is how long was it attached? And this matters a lot, which is why we love regular tick checks. Lyme disease is caused by a bacteria called Borrelia burgdorferi, and it lives in the tick's gut. For that bacteria to actually get into your child's bloodstream, the tick has to be feeding long enough for it to travel from the gut to the saliva and then into the skin. That process generally takes 36 to 48 hours. So here is how you can make a rough call if you're unsure. Look at the tick you removed. Was it flat and small, kind of like the size it was before it fed? Likely low risk. Was it round and swollen, almost puffed up? The tick had been feeding for a while, and that changes things. Flat and small means lower risk, round and swollen means call your doctor. But whatever that tick looks like, flat or puffed up, it is a good idea to watch for signs of Lyme disease. And since we were talking about checking for ticks, this is your reminder that tick checks after outdoor time are not optional. You want to check the scalp, behind the ears, the armpits, the belly button, the groin, and behind the knees, every skin fold, every time. That's actually why I'm a huge fan of showers and baths every day. Is it needed for hygiene? No. But it can be a time to look for ticks or rashes, unusual things on bodies that you may not notice when they're dressed. If this is already feeling useful, go ahead and subscribe. These reminders are needed so that you actually subscribe to the channel. I cover topics like this all the time, and I'm always asking you all what you need in the community section. The biggest red flag for Lyme disease is a rash called erythema migrans. You may have heard it called the bull's eye rash. And here is the myth I want to bust. It does not always look like a perfect bullseye. In most cases, the rash starts right at the site of the tick bite, but it does not have to. Sometimes it shows up somewhere else on the body entirely, especially if the infection has had time to move. And if multiple patches appear at once in different spots, that is a sign things have spread and it's time to call your doctor that day. Sometimes it is a solid red oval that just keeps getting bigger. Sometimes it's a ring with a clear center. Sometimes it's a faint pink patch that slowly expands outward. Sometimes it looks blotchy with slightly brighter edges. The textbook image you may see, that is the most common version, but real life can be a little bit different. And one more thing that textbooks always don't have. On darker skin tones, the rash often does not look red at all because of skin pigmentation. It can look like a bruise, a patch of darker skin, or a subtle ring you'd only catch in good lighting. Studies show Lyme gets diagnosed later in children with darker skin partly for this exact reason. So if your child has deeper skin tones, you're not looking for red all the time. You're looking for a patch or rash that's different from the skin around it and seems unusual to you. Because that's what all of these have in common. They expand. A small red bump that stays the same size for a few days, that could be a normal bug reaction. An area that is noticeably bigger than it was yesterday, that is the rash we are watching for, especially when you're in Lyme country. And here are 3 things parents miss. The rash does not always itch or hurt, so it's easy to overlook, especially in an older child who you may not be able to get access to looking at their body. You may never have seen the tick or the bite, so the rash can seem to appear out of nowhere, anywhere on the body. The rash also does not always appear right after the bite. It can show up anywhere from 3 to 30 days after the bite. You might have completely forgotten about the tick by the time it appears. The rash is the body saying something is not right here, so when in doubt, call your clinician. Here is a simple habit I recommend to every parent. The day you remove a tick, take a photo of the tick, and if there is a rash, take a photo of the rash. Then check it once a day for the next 30 days. If the area starts to grow or change in shape, you have a visual record right there to show your clinician. That photo has been genuinely helpful for many of my families. Now this is where Lyme can get tricky, because not every child with Lyme will develop a rash that someone notices. I know, I'm sorry. Sometimes the rash is in a hard to see spot, sometimes it fades quickly, so I want you to know the other symptoms too. We think about Lyme in 3 stages: early localized, early disseminated, and late disseminated. Localized means the infection is still right where the tick bite is. Disseminated means the bacteria has traveled through the bloodstream to other parts of the body. You don't need to memorize these. Just know that the further along the infection has gone, the bigger the symptoms. And one more thing, these do not always show up in a tidy order. Some kids never get a rash anyone catches, so the first sign a parent notices might be a droopy face, which is Bell's palsy, or a swollen knee weeks later. If you never saw a rash, that does not cross other types of Lyme disease off the list. Stage 1, early localized Lyme. This is days to about a month after the bite. This is the expanding rash we just covered, and it can, but not always, be paired with symptoms like the flu, fever, fatigue, muscle aches, headache. They just don't feel good. But here's the key detail. There's usually no runny nose or cough. A summer flu without the cough, especially after time outdoors, is a tick question worth asking. Stage 2 is early disseminated Lyme. This is weeks to a few months after an untreated bite. This is when the bacteria has started to travel. Signs get more specific here. One side of the face drooping temporarily, that could be a facial nerve palsy, and it needs a call that day. Persistent headaches and neck stiffness. More than one rash patch showing up on the body at once. Rarely, some children have heart symptoms like dizziness or sense of their heartbeat feeling off. These symptoms sound scary, but even at this stage, treatment works. And as a reminder, a lot of the signs I mentioned does not automatically mean Lyme. It's when we know that you're in tick country, Lyme country, and we see these symptoms, it raises our concern and our flags in our head. But just know that anytime your child is dealing with any symptom that you're unsure about, whether you live in tick country or not, it's good to get that evaluated. Stage 3 is late disseminated Lyme. This is months to even a year after. In kids, this most often shows up as Lyme arthritis, swelling and pain in a joint, most commonly the knee, with no injury to explain it. A swollen knee out of nowhere is worth a call even if you never saw a tick. This is also the stage we almost never reach when parents know what to watch for, which is exactly why you're here. The good news in all of this, antibiotics work at every stage. The earlier we catch it, the easier the road. Children who are diagnosed and treated early do really well. The goal is not to scare you away from the outdoors, it is to make sure you know what to look for so we can reduce the risk of getting to stage 3. Now the question every parent asks at this point, can't we just test for it? Here's how that actually works because it surprises people. If your child has that expanding rash and you live in or recently visited a Lyme area, your doctor will likely treat based on the rash alone. The rash itself is the diagnosis. No waiting on labs, no delay. That is actually the right call because the rash shows up before the blood test can even turn positive. If there is no rash, but your child has signs that Lyme may have spread, flu-like symptoms, facial drooping, joint swelling, or heart symptoms, then a blood test may be recommended. But timing matters. The test does not look for the bacteria itself, it's looking for your child's antibodies against it. And antibodies take a few weeks to build up. Test too early after a bite and you can get a negative result even when Lyme may still be present. So if your doctor says it's too early to test, that is not dismissal. That is the doctor understanding how the test actually works. When testing is done, it is a 2-step process and both steps need to agree before it counts as positive. That design exists because a single positive result on its own can be misleading. And even a negative test does not always close the door. Your doctor should be looking at the full clinical picture and not just blood work. One thing worth noting, if your child was already treated for Lyme, blood tests after that point are not very useful because antibodies can stick around in the body for years after successful treatment. A positive test down the road does not automatically mean an acute active infection, meaning a current infection. This is important context if you ever find yourself in this situation. While we're clearing things up, a quick word on treatment. If your child needs antibiotics, the first choice is often doxycycline, and a lot of parents have heard it can stain their kids' teeth yellow. That worry comes from an older related antibiotic. The American Academy of Pediatrics now supports short courses of doxycycline at any age. Your doctor may also prescribe amoxicillin as an alternative. So if it's prescribed, fill it and ask questions to your prescribing clinician. This is one of the most common questions I get after a tick bite, and the answer is, it depends. And that is not a cop-out answer, I promise you. There's actually a very specific checklist doctors use to decide. A single preventative dose of doxycycline may be recommended if all 3 of these are true. The tick was a deer tick, not a dog tick or another species. This is why that photo can matter of that tick. The tick looked engorged, or you know it was attached for at least 36 hours. Remember, that is the window when transmission becomes a real risk. You can get to your doctor or pharmacy within 72 hours of removing the tick. After that window, the preventive dose is no longer recommended. All of those boxes have to be checked. If the tick was flat, removed quickly, or you are not sure what kind it was, prophylaxis is usually not the right call. And if you're outside that 72-hour window, the approach shifts to watching and waiting rather than treating upfront. And this is a lot to do with antibiotic use. We want to be very conservative with antibiotic use in children because it can do its own thing of messing up with the gut. But of course, we also balance it with the risk of Lyme, so talk to your clinician on the next steps. Because this is not a decision to make on your own or based on something you read online. Call your child's clinician, tell them what kind of tick it was. If you know, share that photo, and let them walk through the criteria with you. That conversation can give you a real answer for your specific situation, and sometimes they may need you to come in for a visit so they can see your child and evaluate them. So here is when you should call your clinician. You see any rash or skin patch expanding outward from a bite site, even if you're not sure what it is. Your child develops fever, fatigue, or flu-like symptoms in the days or weeks after a known tick bite. The tick was clearly engorged and you live in or recently visited a high Lyme area. Your child has joint swelling or pain, especially in the knee, with no obvious injury. You see any facial drooping or neurological symptoms. Whether it's related to Lyme or not, we're going to want to know about that. The bite site becomes increasingly red, swollen, or irritated after the tick was removed. I'll keep this part quick because you came here for information and not a whole preventive lecture, but I think it's important. Tick checks after every outdoor trip. DEET-based repellent is safe for kids 2 months and older, and picaridin is a good alternative. Make sure you read my resources on the best repellent spray because the best repellent is actually doing its job of repelling ticks or mosquito bites. Permethrin sprayed on clothing and gear, not directly to the skin, is highly effective and lasts through multiple washes. Light-colored clothes make it easier to spot ticks before they find a home. Shower ideally within 2 hours after being outside, but if not, definitely by the end of the day so you can do a tick check. Throw outdoor clothes in the dryer on high heat for 10 minutes. Ticks survive the washing machine, they do not survive the dryer. Check your kid's scalp like you're looking for lice, okay? You want to make sure that you do not leave any fold left behind. If this video helped, make sure you give it a thumbs up, be sure to subscribe. It's basically a tick check for the algorithm. It takes 2 seconds and it helps other parents find my channel, and I know you all love my channel, but you have to share it for it to grow. Here is what I want you to walk away with. Remove the tick with fine-tipped tweezers, clean the site and take a photo of the tick and if there's a rash. Watch that bite site or anywhere on the body for 30 days and call your doctor the moment anything looks like it's expanding or you notice an unusual rash. Lyme disease is very treatable. Catching it early is the most ideal. You may have questions about chronic Lyme and the terminology and the diagnosis of that. If you want a separate video about chronic Lyme, please make sure to comment below because I do have a lot of thoughts, but I'm only going to do that video if you all want it. My goal with this channel has always been the same, give you real evidence and experience-based information so you feel more informed and capable, not scared and overwhelmed. Lyme disease is a topic with a lot of noise around it online. And remember, subscribe if you haven't yet. I cover pediatric topics not only related to child health, but also development and parenting, and drop your questions below. And if you want that dedicated chronic Lyme video, tell me in the comments and I'll put it on the list. Stay well, do your tick checks, and I'll see you next time.